Bismillahirrahmanirrahim. Today we are going to discuss some diseases that are purely associated with pregnancy. And these diseases, hyperemesis gravidarum, that is the excessive and uh, excessive vomiting that occurs during pregnancy, and the preeclampsia and eclampsia. The preeclampsia and eclampsia are uh, very important serious diseases that are very common, and if not diagnosed early in time and if not treated properly, they can lead to potentially lethal complications, which are not only uh, dangerous for the mother but also for the fetus. Hyperemesis gravidarum is the excessive vomiting that occurs during pregnancy. Normally, about 80% of the women experience nausea and vomiting. The term morning sickness is often used to describe this condition when symptoms usually disappear after the first trimester. And the morning sickness, the nausea and vomiting that occurs mostly in pregnant women, but this happens only during the first trimester. After the first trimester, the condition disappears. This mild form affects the quality of life of woman and her family, where the severe form, known as the hyperemesis gravidarum, it results in severe complications like loss of water due to vomiting, leading to dehydration, which can cause imbalance in the electrolytes, and sometimes, if the disease is severe, the patient may be hospitalized. Hyperemesis gravidarum differs from the morning sickness in that vomiting persists throughout the day. By morning sickness, we mean that it is early in the morning when the pregnant female wakes up, she suffers from nausea and vomiting. But if she is nauseated and if she is vomiting throughout the day, then this is not the morning sickness, but it is hyperemesis gravidarum. Combination of vomiting, nausea, and anorexia, because the female patient then refuses to eat something, it produces a state of malnutrition, and that affects the liver, kidney, heart, and brain. And potentially, it can lead to ketosis, which is the elevated level of ketone bodies in the blood, and dehydration, and anorexia, which will lead to refuse to eat, may lead to avitaminosis, and if there is electrolyte balance, it may cause serious complications. Particularly when the potassium deficiency occurs, it will cause cardiac muscle weakness, and unfortunately, hypokalemia, it will induce further vomiting. Elevated levels of human chorionic gonadotropins are present in all pregnant women during the early pregnancy. But mostly after the first trimester or 12 weeks, the human chorionic gonadotropins, they decline. And we can say that this elevated level of human chorionic gonadotropin may be the cause of the morning sickness, the nauseated feeling, and the vomiting. In hyperemesis gravidarum, decreased fluid intake and prolonged vomiting, it will lead to dehydration, and when the blood is concentrated, uh, automatically the human chorionic gonadotropin concentration, it will be increased. The sign and symptoms of hyperemesis gravidarum depend on the severity and length of time the patient vomits. So usually the patient is apathic, weak, with sunken eyes, rapid pulse, and hypotension. That's the signs that occur in any form of dehydration. The tongue of the patient, it is usually dry and coated. The teeth are covered with sods which are dark brown are blackish crusts like collections on the lips and teeth, and the lips are cracked and sore. There is often a acetone smell because of elevated level of the ketone bodies in the blood. The urine is dark. By that we mean it is highly concentrated and with high specific gravity, and it will contain ketones and low chlorides. Starvation and dehydration may lead to constipation, because if the patient is anorexic, automatically if she is eating nothing, so she will develop constipation. Now we come to the very important diseases that occur during pregnancy and are associated only to the pregnant woman, and these are the conditions that we can see only during pregnancy in a pregnant woman. Now, what is preeclampsia? Preeclampsia is characterized by a new onset of hypertension. By this we mean that if the patient is already hypertensive before pregnancy, then we don't say that this is preeclampsia. And if it is preeclampsia, it will be more severe. So normally, if a patient who is previously non-hypertensive, if she develops hypertension during pregnancy, it will indicate preeclampsia. And also there is proteinuria, which is a marker of kidney damage. And in addition to the kidney, the condition can cause damage to other organs, for example, the eyes, the liver, and the brain. Usually, preeclampsia happens after 20th week of gestation. By that we mean that it occurs at the end of the 5 months, and it can occur even after delivery up to 6 weeks. The symptoms and signs of preeclampsia can range from mild to severe and life-threatening. It can threaten the life of the mother and the life of the baby. We say the disease is preeclampsia, but when the patient develops seizures, then we cut the name preeclampsia and now we say that this is eclampsia. So as I told you that the disease only affects the pregnant woman after 5 months or 20 weeks of gestation, and it can happen even after delivery up to 6 weeks. And the disease is characterized by the new onset of hypertension. By that we mean that the patient before pregnancy was she was not hypertensive. And the second important component is the proteinuria, finding proteins in the urine. And you know that normally the glomeruli, they do not filter protein. But if the glomeruli become damaged, then proteins appear in urine, and we call this condition as proteinuria. And this condition, the presence of proteins in the urine, it is a marker of kidney damage. But in addition to the kidney, the disease can damage other organs like the liver and brain. We call it as preeclampsia if there is hypertension and proteinuria, right? When there is only hypertension and proteinuria, we call the disease preeclampsia. But if the pregnant female develops fits or seizures, then we turn from preeclampsia to eclampsia. Now we call the disease as eclampsia. Preeclampsia plus fits and seizures cause the eclampsia. Now, what causes preeclampsia or eclampsia? The exact cause is not known, but it is clear that the development of an abnormal placenta happens in preeclampsia, and it is said that this abnormal development is the root of preeclampsia. Now, what happens that normally during pregnancy, when the placenta develops, the spiral arteries that supply the placenta and the innermost layer of the endometrium, and the endometrium is divided into during pregnancy into an inner layer, which is the functional layer, and underneath, inside the functional layer, there is a thin layer which doesn't shed during the regular menstrual periods. The functional layer shed away with each menstrual cycle and menstrual period, but the inner thin layer, it remains intact. And the spiral arteries usually grow from this thin layer to the functional layer, and commonly these arteries are dilated and they deliver a lot of blood to the placenta. But what happens in during the development of an abnormal placenta, that these arteries become fibrotic. The wall of the arteries, they develop, fibrous tissue is present in the wall of the arteries and they are fibrotic. So once the vessels are fibrotic, they become narrow and they will supply less than needed blood to the placenta. So we say that in preeclampsia the placenta is poorly perfused. Now the poorly perfused placenta getting little blood than needed, it will cause intrauterine growth retardation of the fetus, and potentially it can cause fetal death. And unfortunately, the abnormal placenta with fibrotic blood and poorly perfused, this placenta release pro-inflammatory proteins which cause serious complications in the body. Now, as I said, the exact cause of preeclampsia and eclampsia is not known, but there are certain risk factors which are well known to us, that it is more common during the first pregnancy, and it is more common when there are more than one fetus. By that we mean multiple gestations. And the aged mothers, if they become pregnant, the risk of preeclampsia is more, and usually it is seen that mothers who are more than 35 years of age, they are more prone to develop preeclampsia. And a patient who is hypertensive before pregnancy, she is at high risk of preeclampsia and eclampsia. Moreover, preeclampsia is more commonly seen in diabetes with elevated blood glucose levels, and if the patient has a family history of preeclampsia or eclampsia, she is at high risk. Now, what happens that the poorly perfused placenta, that is getting little blood due to the fibrotic spiral arteries which becomes narrow and supply less than needed blood for the placenta. This placenta release pro-inflammatory proteins, and these proteins enter into the blood of the mother, into the mother circulation. Now what they do, that these pro-inflammatory proteins will cause endothelial cell dysfunction. By that we mean that is normal, that is not the normal endothelium, but it becomes dysfunctional, and dysfunctional endothelium will undergo vasoconstriction. Moreover, when the blood vessels to the kidney, if they are damaged, so what happens, that the kidney retains sodium and water, and the retention of sodium and water will increase the blood volume of the mother. So the vasoconstriction and retention of fluid in the mother blood, they will cause hypertension, and the damage to the kidney blood vessels will result in damage to the nephrons, and normally, as they do not allow proteins to appear in urine, but if they are damaged, protein will start appearing in urine, and we call this condition as proteinuria. So proteinuria and hypertension, these are the two characteristics of preeclampsia. Now normally when we diagnose preeclampsia, we examine the blood pressure of the patient, we listen to the symptoms of the patient, and we examine the urine for the presence of proteins. Now if the systolic blood pressure is more than 140 millimeter of mercury, and if the diastolic blood pressure is more than 90 millimeter of mercury, it is a mild form of preeclampsia. Remember that preeclampsia can be it can vary from the very mild form to severe and life-threatening form. But in severe preeclampsia, which is the most serious condition, here the blood pressure is systolic blood pressure is more than 160 millimeter of mercury and the diastolic blood pressure is more than 110 millimeter of mercury. And this high blood pressure can cause cerebrovascular accident like hemorrhagic stroke, and it can cause the detachment of the placenta from the uterine wall, which is known as the placental abruption, which can lead to severe bleeding and serious complications. Now, in addition to the vasoconstriction and fluid retention that occurs in preeclampsia, the another thing that happens is local vasospasm. The blood vessels, they become contracted. They develop vasoconstriction, and this vasoconstriction of the blood vessels, which is caused by local vasospasm and particularly of the renal blood vessels, what will happen that the urine output will be decreased. There will be low output of urine, and we call this condition as allegoria, right? Less than 400 milliliter of urine per 24 hours. And additionally, the glomerular damage will cause the protein to appear in the urine, and we call this condition as proteinuria. In addition to the kidney, the commonly affected organ is the eye retina. The vision may become blurred, and the patient may complain of flashing lights, and a condition known as the scotoma, which is a black spot in the visual field, and there can be more than one black spots, and in that situation we call it as the scotomata. If there is one spot, we call it as the scotoma, one black spot in the visual field. But if there are more than one black spots in the visual field, the condition is known as the scotomata. Now the liver can become damaged because the decreased blood supply to the liver may cause liver injury, inflammation, and the liver can become swollen, inflamed, and congested. So the result will be that the patient will suffer from the right upper quadrant pain, that is pain in the right upper abdominal region, and this we say that the patient will complain of the pain in the epigastrium, also epigastric pain. And in the laboratory, in this situation, we will see that there will be elevation of the liver enzymes. For example, ALT, AST, GGT, and other liver enzymes, they will be elevated, and this can give us as positive findings. And the pain that the patient feels in the right upper quadrant is due to stretching of the liver capsule. Now there is a syndrome known as the HELP syndrome. So HELP is the mnemonic. By H we mean hemolysis, by E we mean elevated liver enzymes, and by P we means low platelets. What happens that in the patient of preeclampsia, there is intravascular coagulation and there is formation of thrombi. This is a situation that we commonly see in septic shock. So the formation of thrombi in which the clots are attached to the vessel wall, and when the red blood cells strike to these thrombi, they get degranulated, destructed, and destroyed, and this will lead to hemolysis, that is destruction of the intravascular destruction of the red blood cells. Automatically, when these thrombi, small thrombi are formed, they will consume platelets because the thrombi, they are formed by the platelets. So when lot of platelets, if they are consumed by these thrombi, the platelet count will fall, and we say this is the thrombocytopenia. And itself, thrombocytopenia has serious complications like bleeding. It is important to say that the HELP syndrome and these situations, they do not occur in all patients of preeclampsia, and it is only 10 to 20% of the pregnant females who have severe preeclampsia and they develop the HELP syndrome. Now, what happens that the blood vessels, they show increased permeability. The endothelial gaps, they get opened and fluid oozes out from the blood to the extravascular tissue. So what will happen that the accumulation of fluid in the extravascular tissue will result in generalized edema, which is more prominent in the legs, face and hands. And if unfortunately this edema occur in the lungs, that we say pulmonary edema. So that is very serious and can cause cough, shortness of breath and other symptoms. The same edema, if it develops in the brain, it will lead to headache, confusion and other neurological manifestations. And here at this point, you remember that this is the cerebral edema that converts preeclampsia into eclampsia. In preeclampsia, there is hypertension, there is proteinuria, but there are no fits, no seizures. But when the cerebral edema occurs and if the patient develops seizures, we call the condition now as the eclampsia. Now, the treatment of the preeclampsia and eclampsia depends on the severity of the condition in the female patient and the age of the gestation. So, if the preeclampsia is in its mild form, we can manage it by treating hypertension and by treating the renal damages using certain medications. But the ultimate treatment of the preeclampsia and eclampsia is to deliver the placenta and the fetus. And once the fetus and the placenta are delivered, automatically the symptoms will gradually subside. And even after delivery, the symptoms may take some time to subside. In preeclampsia and eclampsia, that what I said is the treatment depends on the severity of the condition and the nutritional status of the patient and the age of gestation, and they may need some time supplemental oxygen and other medicines. Now coming to the summary, the preeclampsia, we say preeclampsia if the patient is hypertensive and if she has proteinuria. These two are characteristics of the preeclampsia. But once cerebral edema occurs and the patient develops seizures and fits, then we say it is the eclampsia. The preeclampsia occur after 20th week of gestations, and it can occur even 6 weeks after the delivery of the placenta and the fetus. The common organs that are affected by the preeclampsia are the kidneys, where there can be damage to the nephrons and leaking of proteins in the urine, and there can be damage to the eye, to the retina, where we see scotoma and scotomata, and the damage can occur to the liver, where the decreased blood supply will cause the liver to become inflamed and swollen, and the membrane that surrounds the liver, if it is stretched, it will lead to right upper quadrant pain, and the other organ that is damaged and where the preeclampsia is turned into the eclampsia is the brain. Thank you very much.